Dementia is an umbrella term used to describe a decline in cognitive function that interferes with daily life. It's not a specific disease, but rather a set of symptoms that can be caused by various conditions or diseases, the most common of which is Alzheimer's disease. Other causes include vascular dementia, Lewy body dementia, frontotemporal dementia, and more. Symptoms of dementia can vary but often include memory loss, difficulty with communication, reasoning, and problem solving, as well as changes in mood, behavior, and personality. These symptoms usually worsen over time and can significantly impact a person's ability to function independently. While dementia primarily affects older adults, it's not a normal part of aging. It's caused by damage to brain cells, which affects their ability to communicate with each other. There is currently no cure for most types of dementia, but treatments and interventions can help manage symptoms and improve quality of life for individuals living with the condition. Dementia can be caused by various factors, and the specific cause often determines the type of dementia a person has. Some common causes include Alzheimer's disease. This is the most common cause of dementia. It involves the buildup of abnormal protein deposits in the brain, which disrupts communication between nerve cells and leads to their gradual death. Vascular dementia. This type of dementia occurs when blood flow to the brain is reduced or blocked, typically due to conditions such as stroke, small vessel disease, or other vascular issues. Lewy body dementia, LBD. LBD is characterized by the presence of abnormal protein deposits called Lewy bodies in the brain. These deposits disrupt brain function, leading to cognitive decline, visual hallucinations, and movement problems similar to those seen in Parkinson's disease. Frontotemporal dementia, FTD. FTD is caused by damage to the frontal and temporal lobes of the brain. It often leads to changes in behavior, personality, and language abilities, rather than memory loss in the early stages. Parkinson's disease. While Parkinson's primarily affects movement, it can also lead to cognitive decline and dementia in some individuals, known as Parkinson's disease dementia. Huntington's disease. This genetic disorder causes progressive degeneration of nerve cells in the brain, leading to both movement disorders and cognitive decline. Creutzfeldt-Jakob disease, CJD. This rare, degenerative, and fatal brain disorder is caused by abnormal proteins called prions. Other factors such as traumatic brain injury, infections of the central nervous system, nutritional deficiencies, and certain medications can also contribute to the development of dementia. It's essential to note that the specific symptoms and progression of dementia can vary depending on the underlying cause. Therefore, accurate diagnosis by a healthcare professional is crucial for appropriate management and treatment. While there's no guaranteed way to prevent dementia, there are several lifestyle factors that may help reduce the risk or delay its onset. Regular physical exercise, engaging in regular physical activity, such as walking, swimming, or aerobics, can help improve blood flow to the brain, promote neuroplasticity, and reduce the risk of developing dementia. Healthy diet. Following a balanced diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, can support brain health. Some evidence suggests that diets like the Mediterranean diet, which is high in fruits, vegetables, fish, and olive oil, may be particularly beneficial. Mental stimulation. Keeping the brain active through activities such as reading, puzzles, learning new skills, or socializing can help maintain cognitive function and reduce the risk of dementia. Quality sleep. Prioritizing good sleep hygiene and getting enough restorative sleep each night is essential for overall brain health. Management of chronic conditions. Controlling conditions like high blood pressure, diabetes, obesity, and high cholesterol through lifestyle changes, and if necessary, medication can help reduce the risk of vascular dementia and other related conditions. Social engagement. Maintaining social connections and participating in activities with others can help support cognitive function and emotional well-being. Limit alcohol consumption. Excessive alcohol consumption can increase the risk of dementia, so it's important to drink alcohol in moderation or avoid it altogether. Avoid smoking. Smoking is associated with an increased risk of dementia, so quitting smoking can help reduce this risk. Brain injury prevention. Taking steps to prevent head injuries, such as wearing helmets during sports activities or while riding a bike, can help reduce the risk of dementia caused by traumatic brain injury. While these lifestyle factors may reduce the risk of dementia, it's important to remember that genetics and other factors beyond our control also play a role. However, adopting a healthy lifestyle can still have significant benefits for overall well-being, regardless of genetic predispositions. Testing for dementia typically involves a combination of medical history assessments, physical examinations, cognitive tests, and sometimes brain imaging. Here's an overview of the process: medical history and physical examination. The healthcare provider will start by taking a thorough medical history, including asking about symptoms, family history of dementia, or other neurological conditions, medications, and any other relevant information. A physical examination will also be conducted to check for signs of underlying health issues that could contribute to cognitive decline. Cognitive screening tests. Various cognitive screening tests are used to assess different aspects of cognitive function, such as memory, attention, language, and problem-solving skills. One commonly used test is the Mini Mental State Examination, MMSE, which evaluates orientation, memory, attention, and language abilities. Neuropsychological testing. If cognitive screening tests indicate potential cognitive impairment, more comprehensive neuropsychological testing may be recommended. These tests provide a detailed assessment of cognitive function across multiple domains and can help differentiate between different types of dementia and other cognitive disorders. Brain imaging. Imaging tests such as magnetic resonance, imaging, MRI, or computed tomography, CT scans may be used to detect structural changes in the brain that could indicate underlying causes of dementia, such as Alzheimer's disease or vascular dementia. These imaging tests can also help rule out other conditions that may mimic dementia symptoms, such as brain tumors or strokes. Laboratory tests. Blood tests may be performed to rule out underlying medical conditions that could contribute to cognitive decline, such as thyroid disorders, vitamin deficiencies, or infections. Psychiatric evaluation. A psychiatric evaluation may be conducted to assess mood and behavior changes, which are common symptoms of certain types of dementia, such as frontotemporal dementia. Genetic testing. In some cases, genetic testing may be recommended, especially if there is a family history of early onset dementia or a known genetic mutation associated with a specific type of dementia, such as Alzheimer's disease or Huntington's disease. Functional assessment. Evaluating an individual's ability to perform daily activities independently, such as managing finances, cooking, or personal hygiene, can provide valuable information about the impact of cognitive impairment on daily functioning. It's important to note that the diagnostic process for dementia can vary depending on individual circumstances and the expertise of the healthcare provider. A comprehensive evaluation by a healthcare professional specializing in dementia diagnosis, such as a neurologist or geriatrician, is essential for accurate diagnosis and appropriate management.